had chemotherapy for cancer, a new finding shows that exercise helps your immune system to prevent recurrence and secondary cancers. And exercise also helps to decrease cancer even if you've never had it. Now, many people think that when they've had chemotherapy that they need to rest. So when should they start exercising?
Such a good point, because about 30% of people, Vicki, who have cancer and are getting chemotherapy have this fatigue that lasts sometimes for years. It really slows you down. So you should start exercising when you can, because you need your immune system to fight cancer.
So it's not important enough to force it, though.
Well, if you don't want to do it, I mean, you're just not going to get the benefit of it. So if you're prostrate and you can't do it, then you're not going to do it. So you need to work maybe with somebody who's a trainer and work into the exercise, because it's hard when you don't feel like it. So you should try and pick something that you enjoy and do that rather than doing some kind of exercise. It's just something you don't want to do.
So how does it help the immune system?
It's very interesting, because the cells that fight against cancer are the natural killer cells, and the T cells, in other words. And those cells fight against cancer, and they fight against viral infections. And those cells, when you've treated the body with chemotherapy, are affected by the process as well. And when they are, they make these cells inactive. They get old, they get senescent, and they can't do the work that they do so well.
So the exercise makes new ones?
Exercise gets rid of the old ones and makes new ones that get nice and aggressive and can attack the cancer and give you more of a chance to recover from it.
Well, just knowing that ought to be motivating.
Well, it's motivating, and if you have this problem of fatigue that goes with it, that about, as I said, 30% of people who have chemotherapy get, you're just going to have to ease into it the best you can. I mean, there are a lot of things that we should do that protect us against getting a recurrence from cancer, things like vitamin D and, of course, exercise.
An alkaline diet.
Alkaline diet is huge. All those kinds of things that we do are amazingly powerful. Like avoid toxic exposures and have a positive attitude if you can.
Like using even healthy skincare products, because many of those contain carcinogens.
Exactly.
That's what bothers me about a lot of these healthy so-called walks for the cure, because a lot of the companies that sponsor them are companies that sell skincare products, and a lot of their skincare products contain carcinogens.
Yeah, well, there's so many products to avoid that it gets very, you have to know what you're doing to be able to do that.
But exercise needs to be a priority. You need to schedule that into your calendar and make it an important thing to do. You just have to do it.
Sure, and other things like sleep. You need to get enough sleep, because if you don't, your body is in a very stressed state. You make more oxidants that cause damage to your body. There's free radicals that you don't want. So it's important to do everything you can to change the way the genes act inside your body. And that's what we are talking about. We talk about epigenetics. Our genes are not fixed to be in a certain way. They can be turned on or turned off. And if you get cancer, they're obviously turned on. But you can turn them off and make them not give you a cancer by eating the right foods, by exercising, by reducing stress, getting enough sleep, and doing all the things.
Living a healthy lifestyle.
Exactly. And that turns those oncogenes, those cancer genes, off. Lots of studies have been done on that. Dean Ornish is one of the probably most famous people for having done this work.
So eat lots of fruits and vegetables, because you get antioxidants that way too.
Exactly. So when we're looking at having had cancer, we should do as much as we can to increase our chances for survival. And exercise is certainly one of them, and it does so many other things too. It's a great antidepressant. It lowers blood pressure. It makes you feel good. It makes those endorphins come out. So do the best you can. Got cancer? Do some exercise.